Hi, everyone. My name is Raza. I'm a PGY3 in internal medicine, and today it's my pleasure to present my project on gun injury as a chronic illness. I want to thank Diva and Dr. Redelmeyer at ICES for helping bring this project to life, as well as GIM, the department which allowed me 2 research blocks to work on this project. So having said that, I want to lay out a bit of context for this topic. We all know that guns cause a lot of harm. And yet, mostly when guns are discussed, it's often fatalities and mass shootings that are highlighted. And what we noticed in our clinical practice was a lot of these patients, in fact, survived and never survived whole. So they developed some kind of disability. And our goal in this study was to quantify the burden of this disability in this population. But also, as you nuance, we wanted to see if this risk of disability was higher among patients who were intentionally injured, such as by assault or self-harm, compared to patients who were unintentionally injured, such as by accidents. Now, to study this, we used a population-based analysis of adults who were 16 years or older and injured by a firearm and who received medical care at an emergency. And we used a survival analysis method, looking at both death and disability as competing outcomes to see what happens to some of these patients who survive. We also, to identify the actual incidence of disability, use the patient's own application for disability to their physician, which is verified and authenticated by the physician, and gives us some sense of the patient's perspective of their own functioning. What we found in the results was fascinating. And in our sample size of 8,000 patients or so, we found that about 16% go on to develop disability. In our follow-up, average about 7.5 years. So just to bring your attention to the graph in the middle, I'll orient you quickly. The y-axis here is disability as a cumulative function, and the x-axis is time from discharge. And what this shows is that clearly, first off, there's quite a lot of disability. So even the unintentional population, about 10% are disabled at the 10-year mark. And in the intentional population, about that number is about 20%. Other nuances we discovered were that prior mental health history, as well as substance use disorders, predispose you to becoming disabled. We also found, as you can see in this graph, is that quite a lot of this disability is actually happening more than 2 years out from the original injury. Finally, I just want to highlight the fact that most of these patients were previously young and healthy. And it's really quite a profound change in their lives, that the first hospital admission probably that they've ever had in their lives results in such big disability. So to summarize, the upshot of the study is that about 1 in 6 Ontarians who suffers a gun injury goes on to develop disability. And we need to support these people both through preventative measures, which would be mainly policy ideas, as well as chronic care clinics, which treat them like any other chronic disease, because I strongly believe that we can make a big difference in their lives.